Caring for newborn kittens is a heartwarming responsibility, but it also requires attention, patience, and a gentle touch. These tiny creatures rely entirely on their caregivers for survival during the first weeks of life, so understanding their needs is critical to ensure they grow strong and healthy. Whether you are fostering abandoned kittens, assisting your own cat with her litter, or simply preparing for the arrival of these fragile beings, the following guidance will help you navigate the early stages of their development. First and foremost, providing a safe, warm, and secure environment is vital. Newborn kittens cannot regulate their body temperature as efficiently as older cats, so temperature control becomes a top priority. The ideal area should be quiet, away from drafts, loud noises, and other household pets. Use a shallow box or a kitten pen lined with clean, soft towels or blankets. Heating pads or warm water bottles, wrapped securely to prevent burns, can be placed near the kittens to maintain a temperature of about 85 to 90 degrees Fahrenheit for the first week. Gradually reduce the temperature as they grow. Always ensure there's enough space so kittens can move away from the heat source if they get too warm. Nutrition is another cornerstone of newborn kitten care. Ideally, kittens should nurse from their mother, as her milk delivers perfectly balanced nutrients and crucial antibodies for immune support. If, however, the mother is absent or cannot feed them, you must provide a kitten-specific formula, never cow's milk, which can upset their stomachs. Commercial kitten milk replacers are formulated to mimic the composition of mother's milk. Use a sterile feeding bottle or syringe, feeding every 2 to 3 hours around the clock for the first couple of weeks. Hold kittens upright while feeding, and never feed them on their backs, as this can allow milk to enter their lungs, causing pneumonia. Proper hygiene is also essential. Wash your hands thoroughly before and after handling kittens or their feeding equipment. Sterilize bottles, nipples, or syringes after each use. Clean bedding daily to prevent infections or infestations, and always monitor the area for signs of dampness or foul odors. Another crucial aspect of caring for newborn kittens is helping them eliminate waste. Kittens younger than 3 weeks cannot urinate or defecate on their own. They require stimulation. After each feeding, gently rub a warm, damp cotton ball or soft cloth on their genital and anal areas to encourage elimination. This process mimics the mother's natural licking and helps prevent dangerous blockages. Monitor their urine and stools for abnormalities, such as persistent diarrhea or blood, both of which warrant prompt veterinary attention. Weighing the kittens daily helps you ensure they are growing as they should. Healthy kittens gain about 10 to 15 grams per day. Mark their weights and times of feeding each day. Lack of weight gain is a clear sign something may be wrong, whether it's an issue with feeding, underlying illness, or environmental stress. As kittens mature, their needs gradually shift. From around 3 to 4 weeks old, they will begin to open their eyes and ears, crawl more confidently, and show interest in exploring their surroundings. At this stage, you can begin to transition them to a shallow litter tray filled with non-clumping litter. Always supervise their use to make sure they are adapting well and not ingesting litter particles. This is also the time to introduce a high-quality, wet or moistened kitten food alongside their formula, making sure the transition is smooth and gentle to avoid digestive issues. Monitoring for health problems is an ongoing task. Newborn kittens are vulnerable to dehydration, hypothermia, infections, and fleas. Check for signs such as lethargy, excessive crying, vomiting, changes in appetite or stool, discharge from eyes or nose, or labored breathing. Promptly consult a veterinarian if anything unusual occurs. It's wise to establish a relationship with a vet who is familiar with the unique needs of neonatal kittens, as early intervention can be life-saving. Socialization should not be overlooked. Gentle handling from an early age helps kittens grow into well-adjusted, confident cats. For the first couple of weeks, handling should be brief and careful to not disrupt nursing or sleep. As their eyes open and they become more mobile, increase the amount of gentle handling, introducing them to human voices, soft toys, and varied textures. Always supervise children's interactions to ensure kittens are handled with the necessary gentleness. Fostering a bond between the kittens and their mother, if present, is also essential. Avoid excessive handling in the first few days to prevent distress for a nursing mother, and always approach her with calm and reassurance. Watch for signs that she is neglectful or aggressive towards her kittens. Sometimes new mothers need extra support, and in such cases, consulting a vet or an experienced breeder can be invaluable. Preventatives such as flea treatments and dewormers must be used carefully, as young kittens are highly sensitive to certain chemicals. Consult your veterinarian before using any medication or topical treatment. Keep their environment clean and monitor them closely for signs of parasites or skin irritation. As kittens approach 8 weeks of age, they should be fully weaned, active, playful, and eat solid kitten food independently. This is the time to plan for their vaccinations, vet checkups, and discussions about spaying or neutering. Early veterinary care not only keeps them safe from preventable diseases, but also ensures a ledger of their health history as they move towards adoption or integration into your cat family. Patience, love, and careful observation underpin everything when it comes to nurturing newborn kittens. Every hour spent tending to their needs builds trust, ensures their growth, and lays the foundation for a long, healthy life. By following these essential tips, you become an essential part of their journey. Me, offering them a gentle start and the promise of a happy future.